force that blood exerts against the inner walls of the blood vessels. It's the pressure that circulates our blood. It most commonly refers to the pressure within the systemic arteries. There is blood pressure throughout the vascular system, but when you clinically refer to blood pressure, it usually is the pressure within the peripheral arteries. Blood will move from high to low pressures throughout the system. Arterial blood pressure rises when the ventricles contract, falls when the ventricles relax. The systolic pressure is the maximum pressure reached during ventricular contraction. The diastolic pressure is the minimum pressure remaining before the next ventricular contraction. And the pulse pressure is the difference between the systolic and diastolic. And the mean arterial pressure is the average pressure in the arterial system, the average force driving blood through the tissues. This slide really messes up the math formulas, one of the issues I have with Keynote. So what I'm going to tell you is pressure is measured in millimeters of mercury, and you can look at your text to find those calculations that you may need for your homework. So here is a typical blood pressure cuff with a sphygmomanometer on it, used to determine blood pressures. Blood pressures decrease as you get more distant from the left ventricle. There are a number of places you can measure arterial pulse. And again, I'm not trying to teach you your clinical. I'm giving you physiological and anatomical sites that may be used. So blood volume increases, that will increase blood pressure. Heart rate increases, that will increase blood pressure. If the stroke volume increases, that will increase blood pressure. And that increase is balanced against the blood viscosity and the peripheral resistance increase. So stroke volume is the volume of blood that enters the artery with each ventricular contraction. Cardiac output is the volume of blood discharged from the ventricles for each minute. Blood pressure is going to vary with cardiac output, increasing the stroke volume, or the heart rate increases cardiac output, which increases blood pressures. Blood volume is the sum of all the volumes of plasma informed elements. It varies with age, body size, and gender, typically around 5 liters, about 8% of your body weight. Blood pressure will be directly proportional to blood volume, so any factor that changes blood volume can also have an effect on blood pressure. For example, decreased blood volume due to hemorrhage would decrease blood pressures. Peripheral resistance is the force of friction between the blood vessel walls and blood vessels. Blood pressure has to overcome that peripheral resistance to move the blood. Vasoconstriction of the arterioles will increase blood peripheral resistance, which will in turn increase blood pressure. When blood is pumped out of the ventricles, the arteries will swell, and they have a rapid elastic recoil that sends the blood through the arteries against that peripheral resistance and into the arterioles and capillaries. Viscosity is how thick a fluid is. The greater viscosity, the greater the resistance to blood flow. So blood cells and plasma proteins tend to increase the viscosity of blood. Greater resistance to flow, the greater force necessary, that tends to increase blood pressure. So any factor that alters the concentration of blood cells or plasma proteins will also alter blood viscosity. Things like anemia would lower the concentration of cells, which would lower the blood viscosity, which would lower the blood pressure. Blood pressure is determined by cardiac output and peripheral resistance. And the maintenance of blood pressure will regulate those two factors, peripheral resistance and cardiac output. Cardiac output increases, blood pressure increases. That causes the baroreceptors in the aortic arch and the carotid sinuses to be stimulated. They sense their impulses are sent to the cardiac center, parasympathetic impulses are sent to the heart. That will inhibit the SA node. Heart rate will decrease and blood pressure will return to normal. Rising blood pressure would stimulate the baroreceptors in the aortic arch and the carotid sinuses. Their impulses would be sent to the vasomotor center. The vasomotor center would be inhibited. There'd be less frequent sympathetic impulses to the arterial wall. The arterioles would vasodilate, and there would be decreased peripheral resistance, and blood pressure would return to normal. Hypertension is high blood pressure. It's a long-lasting elevated arterial blood pressure. Most of the causes are not known. We do know many things that correlate with high blood pressure, are associated with high blood pressure. Sometimes referred to as a silent killer because it may not have direct symptoms. On top of everything else, it does contribute to the formation of arterial sclerosis. It can lead to coronary thrombosis and embolism, or cerebral. Might see TIAs to begin with, or a stroke, a cerebral vascular accident. Lots of things will help prevent high blood pressure. Chief among them, a healthy diet, a healthy weight, and regular exercise. Should you develop high blood pressure, some of the drugs are diuretics, which help get rid of fluid, and sympathetic nervous system inhibitors. Blood pressure decreases as the blood moves through the arterial system into the capillary networks, so there's very little pressure remaining at the end of the venous capillaries. Blood flow is partly the result of heart action, but it's mostly dependent upon contraction of adjacent skeletal muscles, our breathing movements, and the vasoconstriction of veins. The central venous pressure is all the veins except those returning to the heart from the lungs drain into the right atrium, and the pressure in that right atrium is called the central venous pressure. Factors that influence it alter the flow of blood into the right atrium. It affects pressure within the peripheral veins. A weakly beating heart increases central venous pressure. An increase in central venous pressure causes blood to back up into the peripheral veins, and that can lead to peripheral edema. Increases in blood volume or vasoconstriction increase blood flow to the right atrium, which in turn increases central venous pressure. Exercise in the cardiovascular system, well, I'm not going to say it's a bad thing. Exercise is good for the heart, and it should be a regular part of your life. You can't just do it now and again. Increased cardiovascular system will adapt to aerobic exercise by increased pumping efficiency, blood volume, hemoglobin concentration, and the number of mitochondria. The heart can enlarge 40% or more. Concurrently, you will get a stroke volume increase, and both your heart rate and your blood pressure will decrease. In order for exercise to be beneficial, the heart rate should be 70 to 85% of the maximum, quickly figured out by taking 220 and minusing your age. It has to last 30 to 60 minutes, and it should be done 3 to 4 times a week. All right, I'm going to quit there.